Hello, students. So today I'm very happy and excited to interview this young doctor, Dr. Sai Ganesh. And there's a reason for my happiness. Dr. Sai Ganesh jumped from a rank of 1,10,000 in NEET PG 2022 to a rank of around 700 in the INICET 2022. In a span of 5 months, he made that great leap, and we have been doing this 100% honest interview where we focus on the journey of students and the message that they want to give to their juniors without any kind of promotion. So in the same series, Dr. Sai Ganesh is here with me. First of all, many congratulations, Dr. Sai Ganesh.
Thank you so much, sir.
All right. So can you tell us a little bit more about yourself first? From where did you do your MBBS, and was it your first attempt? And what was your rank?
Sure, sir. This is Dr. Sai Ganesh, sir. I did my MBBS from Rangaraya Medical College, Kakinada, sir. I am
Okay.
from Andhra Pradesh. Uh, I am from batch of 2016, sir. I have completed my internship in this April 2022, sir.
Okay.
And NEET PG 2022 was my first attempt, sir. I
Mm-hmm.
gave it without any preparation. I
Right.
have got around 1,10,000 ranks, sir.
Mm.
After that, I felt it was like an eye opener for me, sir,
Mm.
because my fellow peers have scored around 40,000 to
Mm.
50,000 like without any preparation.
Mm.
So then I started preparing, sir.
Mm.
After that, I started my first reading, sir.
Mm.
By the mid of August, I have completed my first reading, sir, including videos and
Mm.
MCQs, sir. I
Okay.
have simultaneously finished along with videos, sir.
Okay.
After that, my main target was INICET, sir.
Okay.
So I have went through previous year questions, sir. Then I have seen that there is more focus given to first and second prof subjects, sir.
Mm. Mm.
So then based on that, I started revising according to that, sir.
Okay.
I started to revise from first and second prof subjects, sir.
Okay.
Mostly there were questions from pathology, pharmacology, and microbiology, sir, which are the core and base for any of the major subjects, sir.
Right. Got it. So you are saying that you started studying seriously from May after the NEET PG result, and
Yes, sir.
by August mid you completed your first reading as well as the questions, and then after
Yes, sir.
that you focus more on the revision. Is that right?
Revisions. Yes, sir.
Okay, so this is very interesting, Dr. Sai, because many students think that to get selected, even in NEET, they need a preparation for at least an year. And here you
Yes, sir.
could get a good rank in INICET, which is, of course, a tougher examination than NEET. And you did that only
Yes,
in
sir.
5 months. So you told me that in around from June, July, August, around 2.5 months, you could do the first reading as well as the question. So what was your strategy? How many hours were you giving per day? And how were you ensuring that you don't give extra time to a particular subject? What was your strategy?
It was not about like how many hours you study a day, sir.
Hmm.
It's basically how you apply what you have studied. Uh, it it all depends on how your skill of solving MCQs, sir.
Mm-hmm. Can you elaborate on that? What exactly do you want to say here?
Like in INSET, we have questions which are more related to clinical aspects like emergency managements
Hmm.
or any antidotes or
Hmm.
like IV cannulation, those flow
Hmm.
rates.
Hmm.
So I think who have done their internship uh, with very interest also,
Hmm.
they might have a good scope in answering the INS questions, sir.
I understand what you're saying, Dr. Sai Ganesh, but how many questions like this were asked in the examination? Something that you can learn from the ward duty or the internship. There are only handful of questions like this.
Only handful of questions, sir.
Ah,
But those are the scoring, I guess, sir.
okay, fair enough, fair enough. But my question was slightly different, Dr. Sai. I wanted to understand in a span of 2.5 months, did you see all the videos and did you do all the questions, or did you cherry pick? Did you have any kind of strategy?
During my first reading, I have completed all the questions, sir, and all
Okay.
videos I have finished, sir.
In the two and a half
But
months.
during, yes, sir, in 2.5 months, sir. But during revision, what has happened that while I was giving grant test, I was revising everything, sir, from the notes and all.
Okay.
But my grant test score was not rising. It's neither rising nor falling. It's
Mm.
stagnant.
Okay.
So I just analyzed my grant test and
Mm.
saw what went wrong.
Mm.
So after reviewing two, three grant tests, there are specific topics from which there are questions repeatedly being asked, sir.
Mm.
So from then, I have segregated my subjects, sir. Just
Got it.
I used to stick to that specific topics which have been
Mm.
repeatedly asked,
Mm.
and I used to stress more on those topics, sir.
So on the basis of grand test, you understood which topics are weaker, and then you gave more importance
Yes,
to
sir.
those topics.
Yes, sir.
Got it. And the previous year questions, all of us keep on saying that previous year questions are extremely important. So
Yes, sir.
do you also feel the same?
Yes, sir. Those helped me a lot, sir.
Mm,
2 weeks prior to exam, I just revised previous year questions, MCQ discussion videos, sir, of AIMS from
okay,
2017 to May session 2022, sir. I
got it.
have seen subject wise all questions, all subjects, sir,
Mm,
and I have prepared those related topics, sir, for the exam. This
okay.
helped me a lot, sir.
So you did the questions and the related topics, and that helped you.
Related topics. Yes, sir.
One problem, Dr. Sai, many students face when they're preparing is that in the beginning of the preparation they try to cover too much. That we keep on talking about the FOMO, right? The
FOMO.
fear of missing out. That they want to do the big question banks also, videos from here, videos from there, and in that process they kind of overshoot the time, and then they are
Yes.
not left with any time for the remaining subjects. So how did you manage that? Because you did it beautifully in a span of 5 months. You did it, the first reading and then the revision. So you must be good with the time management. So what was your plan as far as this time management is concerned?
Actually, I am also a FOMO person, sir. Because of that only, I used to not get any good score in grant tests.
Hmm.
After analyzing them, I used to
Hmm.
leave topics which I can't revise at the last, sir.
Got it.
So,
Hmm.
because of that, I was able to revise what I can revise more, sir.
Hmm. Hmm. Very nice, very nice. So basically, once you could get over your FOMO, you became more
Yes,
more
sir.
targeted, more focused, and that helped you a lot, right?
Yes, sir.
But
After that, when I have
hmm,
seen my grant test score was graph started rising, it
hmm,
gave me like a positive boost, sir,
got it. Very
so that
nice.
I was able to concentrate more on those topics only.
So many of your friends and juniors who are very worried that their GT's test score is not improving, you would suggest them that try to analyze that GT, focus on the topics that are weaker, and that would help you to improve the scores, right?
Yes, sir. In
Dr.
GTs
Sai,
also, what the bottom five
hmm,
subjects are there,
okay.
uh, we have to see those five subjects. And
Hmm,
for next week GT,
hmm,
if we
hmm,
revise those five subjects and give,
hmm,
and like that, if we give two, three GTs, if there are
hmm,
constant subjects in those week, bottom five
hmm,
subjects, it means that we are weak in that subject, sir.
correct.
So that we have to focus more on that subject.
Right. Dr. Sai, I'm curious that how much time did you used to give to studies in a average day after May when you started studying seriously?
I used to give like 8 to 10 hours a day, sir. That's it, sir.
8 to 10 hours. Not, I mean, it's a good number.
8 to 10.
Okay. And how did you manage to stay away from all the social media distractions?
I have uninstalled all the apps, sir. Just I have kept just only Telegram for any these MCQs discussions and all,
Hmm.
and just WhatsApp for some emergency contacts. That's it, sir.
Otherwise, you would not go on Instagram and Twitter and all those things. You would not go on those apps, right?
No, sir. I have uninstalled them, sir.
Very nice. Very good. Very good. So when you took a break, what did you do to kind of energize yourself again, or
I
just to
used to
have
listen to songs,
listen to music? Okay, okay,
music.
very nice, wonderful. So, Dr. Sai, you got a rank of 735, right, in the NICT.
Yes, sir.
So are you planning to pick a seat, or are you also planning to continue with the studies till NEET PG?
I will get surgery, sir.
Okay.
I think I will be taking that, sir.
You wanted to take surgery only?
Yes, sir.
Wonderful, wonderful. So any last minute advice that you would want to give to your juniors, somebody who is stuck in the same place, kind of stuck in the FOMO, GT is not improving, not understanding what is going wrong with the preparation. Any advice for your juniors?
I have seen most of the people searching for various platforms and all, sir.
Hmm.
What I want to say is that just stick to one platform and
Hmm.
you follow that.
Trust the platform,
That's
whatever
it,
it
sir.
is. Hmm.
Trust that platform. Yes, sir.
Hmm. Right,
Because whichever platform you take, the subject is same.
right.
So just
So
stick to one platform and
So stick to a platform, don't fall for FOMO, try to cover only those things that you can revise, focus on previous year
yes,
questions, focus on the topics from which these PYQs are being asked. If GTs are not improving, look at your bottom 4 or 5 subjects and then work on them, and study for at least 10 hours a day, if I can summarize this interview.
yes, yes. And most importantly, we have to believe in ourselves, sir. If we won't
Correct.
believe in ourselves, we can't achieve what we wanted to be.
Right, right. Very nicely said, Dr. Sai Ganesh. Another reason, see, 1.1 lakh rank, once you have that kind of rank, many students start losing their confidence that I would never be
Yes,
able to
yes,
do it. But, just talking to you, you are so calm and cool and, answering all the questions so nicely.
yes,
I think the students, the juniors should take inspiration from you and learn from you that even if you got a bad rank in one examination, it does not mean that you cannot go to AIMS or PGI. 6 7 months of dedicated study can work wonders. It can completely change the game for you. You would agree with me on
yes,
that?
sir. Yes, sir. Sure, sir.
Great. So thanks a lot, Dr. Sai. I'm very happy to hear your story. It's very inspiring. And thank you for sharing this story with your juniors. And many congratulations and my blessings with you and best wishes for your future.
Thank you so much, sir. It's
Thank
a
you.
wonderful session, sir. Thank you so much, sir.
Thank you, dear. Bye bye.
Bye, sir.